Newton?
I have a question.
Yes, Parul.
Hi, Newton. No, I'm helping out with the census at West Ealing Library, and I just wanted everyone to know that if we are, with government guidance, we are allowed to do it. The training that we are all having is impeccable. It's quite a detailed training course, so that when someone comes to me, I'll have a really good idea of how to help them if they're struggling doing the census.
Thank you, Parul. Yes, there are going to be a lot of census support centers, such as the one that I believe you're running as well. There will be a mix of walk-in appointments and phone appointments. So we, again, subject to government guidance on safety, we're going to let everyone know through media as to how the census support centers will operate. There'll be more than one in Hounslow. As Parul mentioned, there's multiple in Ealing. There'll be there in Richmond and Hammersmith and all of the other boroughs, not just Hounslow. So you can visit the one that's closest to you. Just because you or your community members are Hounslow resident doesn't mean that you're obliged to use the Hounslow CSC. If you're near Chiswick or you're near Feltham and there's someone else closer to you in another borough, by all means, please feel free to use them. Thank you. Any other questions? I saw Vincent from the Beehive raise his hand.
Hi, Newton. Good presentation. I have two questions for you, but one I believe has been answered by Parul. The question was on training needs for us so that we can respond back to the community. So I'll look for the training material and prepare myself and our team to respond back to our community. Second was, on the security of this, i.e. you mentioned that, be careful of, the door-to-door, that there's no charges. We have seen on and on again that, people are being scammed, people are being, no matter what we do, I'm just wondering what kind of things are we going to let our community know? I mean, of course, iCard is something that they will come along. What other things should, some things that I can put. Of course, I haven't seen your marketing material yet. Maybe what I'm asking, that question may be answered, but I'm just wary about the scams, the door-to-door scams. And with the lockdown, I think this will just continue. So any comments on that?
Absolutely, Vincent, and it's a good observation. It's not just a census. There are other things happening in our society at the moment where people are coming to the door asking for money, and vulnerable citizens and residents who are not aware will end up falling prey to these scams. There's only so much we can do except to educate and remind. So on the actual census pack, it will be very clear that it is a government document that has to be filled in. But if you are having concerns, your community member feels that they are being asked, they should be cautious of somebody coming to the door. Anybody coming to the door from the Office for National Statistics or from the government will wear an ID badge. The ID badge can be presented on demand. It will have the royal emblem on it as well. Additionally, they will have a high-vis jacket which says Office for National Statistics. It's very easy to identify somebody who is coming to the door. Somebody is coming just like that without anything, saying I'm from the census. Everyone should exercise caution. Just as somebody comes from a bank to your door, you'll be very cautious about opening your door because there is no ID or presentation of material for security. If there are other concerns, again, please work with us. We'll help engage. But that's the message you should be passing to your community. But good observation.
Thank you, Newton.
Thank you. I think there's time for one more question. I don't want to hijack the agenda. Yeah. It's a very interesting topic.
I've raised my hand. Newton, I've heard your presentation before, so I'm very familiar with it. But there's one element which is still, I'm still a degree of uncertainty. For people who have disabilities and who live on their own, what support or are the carers or the wardens of the residents where these people are living, will they be able to complete the forms on their behalf because of their disability?
Yes, okay, to the best of my knowledge, it's the proxy mechanism where if there's a carer or if there's a family member who is not living in that household, if, for example, an elderly resident is shielding, we are speaking to Age UK, for example, so that all of our elderly residents in the borough using the services have a point of contact, etc. We are still working through the mechanics of that. We can't enter anyone's home to help them fill in their census because of COVID. But if there's an elderly person and they have a family member not resident there that can help them fill in the census, that's also possible through proxy. We are still working through the mechanics of doing this in a safe and compliant fashion.
And what happens for people who have other forms of disability? Say, for example, someone who's got a vision impairment or something like that. Are you working with the West? Say, for example, like we live in Hounslow. Are you working with the West London Group for the Blind and other organisations, or are you, or should we as a group be contacting them to contact you to get your presentation? Because I'm sure that to get a proper census in terms of disability needs in our borough, we need to get as much information about those people.
Absolutely. And we are having a very strong focus, Mukesh, on accessibility. If a resident is visually impaired, the census questionnaire can be sent by post in Braille. There are other mechanics where if somebody is hard of hearing, then the call center is equipped to manage with that in terms of hearing disability as well. We're also working nationally with the National Organization for Blind People or Hearing Impaired, and we're working nationally with them as well. In Hounslow, we are working with communities, with organizations responsible to support residents of Hounslow with accessibility needs as well. So we're hoping to make this census one of the most inclusive and accessible ones ever in the country. But I appreciate the fact that there will be some gaps that you as BME leaders can help fill. Thank you for the question.
Can I just say a word? I have, first of all, I already received majority of your marketing product, and I want to say to have in a different language with exactly all the directions and information needed. My only thing is that I want to see what will be the result at the end of the year. I'm really geared up on that. The community has received, the Portuguese speaking community has received the census with willingness, and I just want to thank you for all the support you have provided.
Thank you very much, Francisco. It's great to see the engagement of the Portuguese community. As you have mentioned, a lot of material is available in Portuguese as well. If you feel, or anyone in the room today, feel that they need some support in additional languages not on the list, we can't promise you we'll give you material in that language, but we can supply you with some blank presentation templates for you to add a few words or supplement it with your language, but it's highly unlikely because we've covered quite a few languages as well. But work with us, email me, message me, and we'll try to support you as much as we can and engage with you in your communities. And on that note, Ian, I think we've had quite a few questions. I'll hand the floor back to you, and thank you for your time.
Thanks very much for that, Newton. Like I said, I'll send the information that you've sent me out to everybody after the session. Yeah, so thanks a lot for your time. Bear in mind we've got quite a few speakers, so I'll just rush through, basically say, so I'm a funding and group development officer with Ealing and Hounslow CVS, so I do a regular, every Thursday afternoon, longer session, about an hour, latest funding opportunities. I don't think we've had that many new opportunities in last week. We've got the Mayor of London's got a new food routes incubator program. I can send the slides out after the session. There's quite a lot of funding opportunities on here. Like I say, I do a longer session every Thursday afternoon, 2:30, sign up on Eventbrite. Also the e-news, so let me know if you're not signed up to any e-news, because we have latest funding opportunities in there as well. So yeah, bearing in mind we've got quite a lot of speakers, I think, just check the agenda again. And now let's Parul introduce herself as the new Network Safeguarding Officer.
Hello. I'll be very, very brief because I know we're a little bit behind time. Just started as the Safeguarding Officer for Ealing, working with Ian. I also working at the Volunteer Centre. I just wanted really to introduce myself. I'm getting up to speed. I have safeguarding experience working as a trained therapist, and I'm a member of the BACP, which is the British Association for Counselling and Psychotherapy. So I need to get myself more clear about what's happening in the Borough of Ealing, which I'm doing at the moment. But my email address is on the slide, so please do not hesitate to contact me if you need any information. And hello.
Thanks, Parul. Yes, obviously, as Ealing and Hounslow CVS, we do cover both Ealing and Hounslow. So, yeah, I mean, it does help more sort of integration, I suppose, across borough work. So, in that light, I'm just going to introduce Jane Medici, who's our new Digital Capacity Building Project Officer in Hounslow. Jane, do you want to introduce yourself?
Okay. Hello, everyone. I have, can you hear me?
Yeah.
Great. I've just started with Ealing and Hounslow Community Voluntary Service. So I'm literally on my 5th day in the role, but I have got a couple of things to share with you in terms of what the Digital Capacity Building Project will bring to Hounslow in particular, which is where the funding comes from, thanks to Hounslow Borough. So I'm going to just share my screen and show you a couple of bits. There we are. Can you see that?
Yeah.
Got that? Great. Okay, so the project is, the intention of the project is to build the IT and digital capacity of Hounslow's voluntary and community sector to better support the vulnerable residents in the post-COVID-19 environment. It is only a year long, so within that year, we have quite a lot to do, and working together, I'm sure that we can achieve it. The project aims to support local Hounslow organisations and communities to adapt and evolve and continue to deliver their much needed services. So as you know, COVID has had an impact on the delivery of services by many of our local organisations. We're hopefully going to be able to help you overcome the issues that you've faced in not being able to meet your service users face to face. Next slide. Hold on a second while I move on to my next slide. There we are. This is just to give you an idea of everything that we're going to put together over this year. So as part of the project, which has started now, we are actually now having started. my starting on Monday was the start of the project. We have got the things that we're going to do now is we're going to identify exactly, working with you, what your specific priorities are. Working with you, with any organization who would like it, we'll do an organizational digital review. We're going to recruit digital champions who will work with individual organizations. We've got funding to recruit up to 100 digital champions in Hounslow. So hopefully you will soon be able to send someone our way for some training, and they will then come back to you and help you become a really techie organization. We're also alongside that developing a digital toolkit, which will give you all of the apps and tech that will help support you as an organization. By July, which is the midpoint of the project, we'll have begun our training and the development of our digital champion network, which isn't only for now. Our digital champion network will become a self-supporting, mentoring collection of individuals who will go into the future with you. The use of the digital toolkit will constantly be reviewed and updated. So by July, you will all have access to a digital toolkit, which I know Ian will be putting out on the e-news as well. There will be ongoing training. Keep your eyes open for that. There'll be seminars and Zoom sessions for every organization to participate so you can understand fully what's out there, what technology is available. And we're not talking about high-end, high cost. We're looking at your financial capability and trying to look at what is available that will fit your pockets and still meet your needs. Then by December, the project comes to an end. We'll be reviewing everything that has been done and hopefully transitioning the network into something that will continue into the future. So as an initial look, we'll look at your service, see how COVID-19 has impacted on you, what your digital capacity and technical basket look like, what you are using, and what would suit you in future. The digital champions will either be people who are currently working with or volunteering for your organization. They'll be identified by you and trained and supported by us. The training and development pathway will provide them with skills and knowledge that they need to support you. Alongside that, think of them and think of this as an opportunity to identify individuals that you as organizations feel have got the capability to perhaps develop as digital champions. This will give them an opportunity to expand their employment opportunities in future and give them really, really marketable skills. So please immediately start thinking of people, young people, old people, people who really have a good understanding of our local community. The digital toolkits will be something that's available very shortly and will be constantly updated. We'll be giving an app of the month, something that we find, something that you find and want to share with everyone. So just to end off, I want to just have a look specifically at the digital champion, because this is going to be a big piece of work and we really do want to begin recruiting. So if you or anyone you knows in your organization have somebody in mind who you think has got the capacity or the ability, the potential ability to perhaps support you with just a few more skills, please send them my way. My contact details are right here. These notes will be available. And of course, our website is available as well. I'm going to come out of the sharing and get back into that. I seem to have lost you too. Oh, there you are.
You want to stop sharing?
Yeah, I'm trying to look for my stop sharings. I've been talking too much now.
Yeah, if you go to share screen, you should be able to stop it. I think
Ian,
I can.
Ian, as your host, you can cancel it.
Yeah.
That's it.
There you go. Sorry, I'd lost that for a moment. Hi, Mukesh. There we are. Thank you.
Hello, Jane. Good to see you again.
Yeah, it's good to see you. Okay. Has anybody got any questions? I know that was really quick. We only have a few minutes and we want to get on to the other speakers as well.
I'm sure. Hi, Jane. It's
Hi,
Shanjit.
how are you?
Shanjit from Sunshine of Hounslow.
Yes. Hi, how are you?
Bring a plenty of sunshine to everybody.
Yeah. It's what a wonderful day.
Yeah, beautiful. Yes, there will be plenty of organizations which will benefit from your project. I think it's a very good idea. At least finally the organizations getting to recognized, and also the sport, they are desperate, everyone desperate for sport. They required, especially the sport you're offering. So I'm the first one.
Okay, Shanjit, thank you so much. Will you please send me an email? We'll be beginning networking on this almost immediately. So I want to include anyone who's interested. Thank you.
We have sent our emails already in the chat. You have got so many.
Fantastic.
All you have to do is just check.
Lovely. All right.
Thank you.
Thank you. Richard, you've got a question as well. Richard, your mute is on.
Unmute myself, yeah. Right. So
hello,
welcome,
Richard.
Jane. Yeah, your name is familiar, but I can't.
Yes. previously worked in Hounslow Council. I worked with you on a couple of committees.
Right. Yep. So yeah, that's all right. So I was in the council. Yep. Excellent. Yeah, I've previously registered interest with Ian for Active Base CIO, which is one of which is the charity to take over management of Isleworth Public Hall. So we need to get a digital footprint.
Brilliant.
I'll probably volunteer as a digital champion myself, and currently I'm working for Metro Charity, which is a reasonably substantial charity based in southeast London, but covering all of London. So I might be able to steal with pride some bits that we've doing there,
Okay.
grassroots. But yeah, we've got Active Base has been operating for a few years now, but we haven't in the development phase, but we haven't got a digital footprint, and it's just a question of seeing the wood for the trees, and just committing to what is the right tools.
Yeah. That's brilliant. Thank you so much, Richard. I really look forward to working with you. I know how active you have been for so long in the borough.
Thank you.
Anybody else?
Vincent.
Vincent.
Vincent's got a question.
Hi, Jane. Welcome.
Hi,
and
Vincent.
just a quick comment. That would be, we are here to help, and I shall email you of some services from our side as well, which could benefit, because I've gone through the whole journey, and I know how painful it can be.
Yes.
So happy to help. I have another question on the champions, but I think let me connect with you separately. Maybe you will have answers on the slide pack that you may have separately for us.
Okay, lovely. I look forward to speaking to you, Vincent.
Wishing you all the best.
I think
Mukesh.
Lisa, I think Lisa had a hand up first.
Oh, Lisa. Okay, I haven't got everyone.
Gosh, I think you're going to be a knight in shining armour, Jane, because this is where I think lots of small organisations, we could be delivering a great service, but then if your digital platform and your skills are not up to standard, it's, you could be brilliant, but the message isn't getting there, and the advertising, no one knows about us. So when would you be, I personally would be really interested, and also I could probably bring someone else in that could also support me. And when would you be delivering it? Would be a time to suit like the both of us? Because, for instance, I work kind of throughout the day and sometimes late into the evenings as well. So when we are up and running.
Yeah. So we aim to actually fit in with your schedules.
Right.
The value of the small organization can't actually be understood unless you've worked in a small organization, and the kind of hours that the small organizations in the third sector and Hounslow are working are unbelievable. So I understand that we have to fit in with your time schedule as well. We'll try and set up some network meetings where everybody can get together, but at the same time, I need to meet with individual organizations to do a kind of assessment of what you have in place and what you need to get in place, because there'll be everything from, do you have a website? Is your website connected to social media? Are you visible? What kind of tools are you using to record and attract your service users? How are you recording the interaction with your service users? And of course, recording all that data will have an impact on the kind of bids that you can apply for, because so many bids require data.
Yes.
So how do we use technology to record that data? So everything within that area needs to be discussed on an individual basis. So send me an email and we'll diarize a time.
Thank you ever so much.
Okay, not a problem.
Thank you.
Okay, Ian, who was next?
Mukesh.
Mukesh.
Yeah, hi. I'm going to be one of your volunteers anyway.
Ah, fantastic.
Because of my techie experience. But what I wanted to highlight, as and whenever the lockdown does start to get lifted, I sit on the board at Ivy Bridge at the Bridgelink Community Centre. And one of the projects we've been doing during the lockdown is actually refurbishing the IT centre there. So at some time or another, if we're not going to be doing a Zoom or and we need to do physical face-to-face, we will have a brand new computer suite at the Bridgelink Centre. So as it is a community centre at Ivy Bridge, it's probably a great place for the people at one end of the borough to be able to use in terms of facilities. And I have links with also with Heston West, big local, and they have access to Cranford Community School. So as time, as time develops, we may be able to not just do it via Zoom, but some of the people who need more face-to-face type activity, and the lockdown gets lifted, there are a few community locations which probably would be able to allow people to sit down and use equipment and software and be able to do social networking as well. So it's just a thought for you later in the year, once things start easing up. Okay.
Thank you very much, Mukesh. I was aware of the Ivy Bridge Centre. I wasn't aware that it was undergoing refurbishment. And I've been in communication with the centre manager there. So that's going to be quite an exciting opportunity as well, because Ivy Bridge in reality is actually central to our borough. It's very accessible in terms of public transport, and there's parking there. So a very, very good centre for us to use. And I'm quite interested in Heston West as well. And I think drawing on your expertise and local knowledge is going to be fantastic. Thank you so much, Mukesh.
And just to add that Jane will be hosting a launch event on the 17th of February. So I'll send the Eventbrite link to sign up for that. So I think it's going to be Wednesday, 11 a.m. to 12 on the 17th of February.
Yeah, that's it. And of course, everyone is welcome. Please spread the news, because we want as many organizations locally involved as possible. This isn't a one-way trip. It is about going together. Everyone who gets involved will be able to contribute their knowledge and expertise and their points of view and what it is that you need in terms of your digital capacity building. Thank you. Thank you, Ian. I'll pass over to you.
Thanks, Jane. We've now got Sasha Rathore. She's Community Engagement Officer at Hounslow Council, and she's going to talk about the Hounslow Community Champions Project.
Hello, good afternoon. Oh, not good afternoon. Good morning, everyone. Thank you for having me today. I don't know, Ian, if you've got a moment, I was just having some difficulty. If you could put up the graphic from an email I've just sent you. It's just a simple graphic that I've got.
I'm just trying to get out of my PowerPoint I'm in.
So my name's Sasha, and I joined the Hounslow Public Health team in the role of Community Engagement Officer earlier last month. My background's medical anthropology, so that's looking at illness, health and healing cross-culturally. So for me, the role of Community Engagement Officer is to ensure any healthcare intervention prevention strategy is delivered in a culturally sensitive and appropriate way. So just making the healthcare messages as effective for the target audience as needed. I'm very pleased to be leading on the Community Champions programme. The Community Champions programme was launched back in August last year, and we've now got 110 community champions signed up. I'll just give you a brief description of what we would say our community champions are. So they are essentially volunteers who, with training and support, help improve the health of well-being of their families, communities or workplaces. They motivate and empower people to get involved in health promoting activities, create groups to meet local needs. They direct people to relevant support and services. Community champions reflect their local communities and vary by socio-demographic factors, including age, ethnicity, gender, health status, and education. They contribute in different ways that range from relatively passive involvement, such as sharing information, to more active involvement, which includes consultation to provide insight into community needs, and collaboration, which includes working in partnership and having shared decision-making power in the planning, design, implementation, and evaluation of services. So the community champions of Hounslow are as diverse as the borough is. I've been happy in getting to meet some of the community champions only last week and this week. So we're aware of how important it is to utilise existing trusted connections. And so we welcome people that have very far-reaching networks of people, as well as those that may only have a small network of people, even maybe just a handful of people to engage with. A weekly newsletter is sent out to the community champions. So that will include up-to-date key information. So currently surrounding the COVID-19 pandemic. And the idea is that the champions can then work with their networks in appropriate ways. So some of the champions may well be using their social media platforms, so Facebook, Twitter, Instagram, to name a few. Some will compose emails, text messages, and use WhatsApp. And we've heard from some of the champions, and it's great to hear that those that don't have digital access or are aware that people don't have smartphones, internet connection, they are being reached out to. So I've heard of one champion going door to door or making written notes, as well as one of the champions talking about how she has on a weekly basis decided what messages were key, and she's actually ringing them. So she's ringing almost 40 people on a weekly basis to ensure that they are having that understanding and insight as to what's going on. Essentially, the Community Champions Programme it sets out to both disseminate the correct and up-to-date information to different communities in the borough, but it's also set up so that we can have an understanding of what's going on in the community fed back to us, so that we can better devise prevention strategies accordingly. So it's proving really beneficial in terms of engaging more with the champions on a regular basis to hear their experience and what they're hearing on the ground, and what else might be more useful to kind of organise. We've also had already as well that a lot of the champions talk to us about their interest in going beyond COVID once this is hopefully come to an end. But in terms of there obviously being a need that we're recognising for champions to be involved in the healthcare messaging. So essentially, it's been great listening to or finding out a little bit more about all of you so far within this meeting. And I'd like to invite any of you to join as champions yourselves, but also to maybe contact me if you wanted to nominate someone. So the idea is that we really welcome people that that may well have large networks that they can engage with, but equally we're happy if you've got a small network, because we just really want the reach to be as thorough in terms of hitting our hard to reach communities, as well as those that may not be considered hard to reach but may not be engaging with the conventional messaging that's going out. So yeah, that's a little bit about the Community Champions Programme. Did anyone have questions?
Is there such a thing in Ealing as health champions?
There is, yeah, there is. I'm not entirely sure who the member of staff is that's leading on it, but I can find out and give the details to Ian to relay to you.
Because they should be absolutely crucial right now.
Absolutely, yeah. I mean, I think as far as I can understand, most boroughs, it's countrywide. So there was a meeting where we've been sharing best practice to understand how else other boroughs have been using the champions. That sounds terrible, but using them to the best possible effective way. Yeah. And it's just been really great to kind of hear. There was one borough talking about doing Facebook live streams and things, or making little videos. So not everyone's going to have the time to read through an email, or including myself, sometimes when I get big bodies of text, you just want a snapshot of what's going on, and you want it to be credible. You want to know it's coming from an official source, but equally you don't want pages and pages to have to reel through, and sometimes information can become confusing. So it's all about really trying to make the messaging not too short and sweet, so that the kind of the point is lost and not effective, but really having the balance of knowing what is being received well and recognized, or what needs to be given more importance and emphasis to. If there are some, even though some of the messages are kind of being repeated, it's necessary, but maybe finding different ways instead of always just sending them to the same link.
The same, yeah.
not accessing the links and finding it comfortable to use some of the kind of some of the NHS websites. They just might not be as user friendly for some people as others. But then we just need to know that we need to strike a balance and then also do kind of more kind of diving into what could work, and again attending more meetings where they're already not more meetings, but just tapping into whatever. I mean, if it's faith-based or if it's whatever's already familiar and comfortable for a lot of people, essentially.
Yeah, I know. You don't want to talk down too much. Some people receive better if they're told, 5 points.
Yeah.
Other people need, a very slow warming up to the topics, and yeah.
Yep. Sorry, Lisa. I think you've got your hand up.
Yeah. So we're a community swimming club, and we're really diverse. And I'm really interested in trying to combat inequalities in sport, particularly in swimming. I've lived in this borough for 42 years, so I've grown up, I've brought children up. I might be of use in the future because I'm really interested in the whole social prescribing. And I've booked onto the conference at the beginning of March, and also applied to be a social prescriber. So it's just and I'm really interested in, my big thing is improving people's lives through physical activity. And I've also recently I'm on the London Sports Development Coalition, and that's to do, and I just wrote a report which they was really happy with. So it's just about the inequalities and breaking down barriers, because there is a huge need in this borough for learning to swim, and particularly amongst the BAME community. And yeah, it's just going to be the #1 factor for improving health. So that's what I'm really into. So we might be able to, I might be able to be of help in the future, or just, collaborate in some way.
Definitely, that's really. So you mentioned 42 years. You've lived in Hounslow, is that right?
Yeah, I've lived in Hounslow for 42 years. Yeah, I was. I've been a competitive swimmer. I've represented Hounslow, and now I've taught swimming in the area for ages. But it's been really frustrating because I've not had a voice. My experience hasn't been utilised. I've had doors on my face all the time, and so I'm just trying to spread the word and trying to change things. And first of all, I think when the first presentation was basically, no one understands the community better than us. We're the people that live here and work amongst it and live amongst it, and see our neighbours on a daily basis. And there's lots of crisis going on at the moment in our borough, and we're in a real position to try to change things if we're allowed to, if we're given a voice.
So I'll be keen to follow up with all of you, to be honest. But be in touch that soon. That's really helpful.
I think Mukesh has got a question.
Yes, hi Mukesh.
Hi, I wanted to compliment you on the weekly news thing which you send out. I find that that's really got the messages to the point. So whoever's doing the editorial aspects of it.
I should just be honest. I only joined the team the beginning of last month. So as of last month, yes, it's been me. But it's been great to see that we have been having feedback, which is helping to shape the fact that it can't be, graphs and graph statistics and all of that. It does need to be, as best.
Yeah. The other thing I find, which unlike. This is where the inconsistency in the messages from London Borough Council is that some of the messages we can actually, it actually says you can view on a browser, and others don't allow you to view on a browser. So I always read your email, which it comes through, and then when I want to share it with people, I view it via the browser and then copy the link and then share it to my community groups, which I'm part of. And that way I don't lose any of the quality of the information. Whereas when parts of the London Borough Council don't do that, what happens is that you can only copy and paste bits of information which lose some of the fidelity. So I'm pleased that you're doing that. So if a message to across the the groups which are sending out us useful information, if they could make sure that it's viewable on a browser as well as just as an email, because forwarding an email, you then got to do distribution lists and you've got to blind copy people, whereas it's much easier just using the copy link from View the Browser. So thank you very much for doing that. And I get lots of compliments back saying, thank you for letting us know. And I tell them, why don't you just register yourself? But you know what people are like, they don't want to register. They think you're going to do the work for them.
But the other thing that I did really want to try and push, I know I'm keeping on a bit, was a little bit about, just like you said, people that have got networks. It's great because it's just going to spiral and people will realize that they too are most eligible as being a champion, just because you don't know what seed you're planting in terms of sparking someone else's network that may well be bigger within your network, if that makes sense. So it's great. I'm really pleased to be working on this and meeting everyone. Shall I hand back to you, Ian?
Okay, thanks, Sasha. Any more questions? Okay, we now go over to the recently awarded Mukesh. I'm sure Nikon's just around the corner. He's going to share his experiences, and I've got a very astute photo.
Oh, wow, you got it.
Experience.
Wonderful. Yeah, you like the posture of my hand, didn't you? It's in the correct position. That's what the lady told me. She said, "You've done this before."
Yeah, I think we had discussions last week about reluctance among certain communities to get the vaccine. So we thought Mukesh is his recent experience, maybe he can give some personal insight.
Yeah, one of the things which came about because of this picture was that within our Hounslow Friends of Faith community and some other groups, we've been also flagged that, and when we've been talking to Kelly, which is the Director of Health at our various meetings, she was quite keen that we kind of warm up people to the fact that it's not dangerous and it doesn't hurt you and this, that, and the other. So as I'm quite good at telling stories, I thought I'd do my own story. I've already done my mum and dad's to their age group, and they're all in the, like my dad's 88, mum's 83, and I sent pictures to their peer group, and a lot of them said, yeah, we're all going for it. So I thought I'd do one for myself, as Kelly had requested. And I just wanted to share my little story, which is different perhaps from the normal story. Just at the beginning of this week, I got a phone call in the morning from my GP saying that they've started a new process where they're going to have people to be on standby in case they have any spare vaccinations, because there are people who miss their appointments for whatever reason. And what she said to me was that we'll have a list of people and we'll just go through them and we'll just ask them to get to the clinic as fast as possible. So my story with this picture was that I got a
We've lost your
and
sound.
They said, could you sorry, are you there? Can you hear me?
Up. Yeah, I think we lost about 30 seconds there, so if you go back a bit.
Can you hear me now?
Yeah.
Okay, the internet is not working. Asking me to attend a could I come for a vaccination at 5 o'clock? So I had 20 minutes. So my answer was yes, straight away. And I got to the clinic at 92 Bath Road, which is the heart of Hounslow. They had my details. They checked me in, and they literally just said, can you come and sit down over here? I was already in a t-shirt, as you can see, which is a really important thing that when you're going for the vaccination, is that try and keep your arm clear, especially, and then they ask you a question, are you left-handed or right-handed? And I'm right-handed, so they put the jab in my left arm. And I didn't even feel the needle. I think they're using very fine needles. But then they told me, they had already explained to me that I was going to get the Pfizer vaccination. Now, the only difference with the Pfizer and the AstraZeneca one was that I had to sit there for 15 minutes because they just in case there was any issues or anything like that, like with any kind of vaccination. But while I was waiting, I had one of the girls one of the nurses take a picture of me, and I wrote a little story. And would you believe it? About 300 odd people decided to view it and read the story. But the most important message which I wanted to share was that there is light at the end of the tunnel. You as an individual, if you get a request, please go and have your vaccination. Don't believe the misinformation. There is so much anti-vaxxing stuff, and I'm because I've been involved with polio immunizations. I'm very keen to make sure that we get this COVID one because many of our BME community are very scared. But the biggest misinformation is that it contains animal products. So people are thinking because of their faith group, they might not have the vaccination. It's not made from any animal product. It doesn't alter your DNA, which is another thing. If it did, well, I think I might become a bit more brainier. And the other thing, it doesn't affect your fertility. Those are the kind of things which are being spread by many of the anti-vaxxers. And the most funniest one I've seen is where people say they put a microchip in. So I'm hoping that someone around the world, if they're seeing me going shopping or sitting in my house or walking around my garden for the next few months. But the other thing is I would always advocate, my whole family now has been vaccinated, mainly because my family are in the NHS, so they're frontline workers. So either being doctors or opticians, they've all received their immunization. That's their first one. And we've had a mixture of AstraZeneca and the Pfizer. It doesn't hurt, but it does mean that you should go and have your vaccination. And I'm a absolute keen that our members and our friends should do that. So hence my photograph, hence me still wearing my mask to prove I'm still observing all the required things which the government recommend. But that's my story, and I would advocate, please feel free to ask me any questions or share my story with other people. It's the most important thing is it's to get immunized so that you start protecting yourself and start protecting others, because now most of the stories on the TV are talking about how you're protecting others by having your immunization. I hope that helps everybody, and I'm more than happy to take any questions. And Ian, I hope I haven't taken up too much time. Thank you.
No, thanks very much, Mukesh.
Okay,
yeah, so go ahead.
I think Vincent's got he had his hand up. Or
no, I just wanted to say that was an amazing share, Mukesh, especially the comments that you mentioned about the chip and DNA. I think I've seen those messages as well, so it's quite hilarious. I also heard the one where this is a strange one. The howling on a full moon. that was a crazy one. But thank you for sharing. I think I'm going to use, once when we get the material from you, and I'm going to use your picture as well. So
yeah, feel free to, and I'm more
local
than happy.
celebrity.
That was the other thing. I think Sharanjeet mentioned this week, out of the blue. Well, not really out of the blue, because I knew in the summer that I was awarded something called the British Citizen Award, and there are 27 people in this country who were recognised for that. Unfortunately, because of the pandemic, it was meant to happen during the summer, so we were told to keep quiet until later in the year, and later in the year didn't happen. So my certificate and the medal which I've received actually has a mention of the pandemic. So if nothing else in the future, if my grandchildren see this certificate or anybody does, they'll actually have the words the pandemic during that period. But for me, just the very fact that I'm one of 27 people, I think I'm going to treasure this perhaps more than if somebody says to me, "Oh, you're going to get you got an OBE or MB." Well, they give hundreds of those away. There's only 27 of these, so it's going to be worth a few bob. They told me it's worth the medal itself is £400, so I've got to insure it for that much. So I'm really pleased and chuffed that a couple of people nominated me for it, and I must have been, I'm just one of those unsung heroes, but just thought I'd share that with you as well.
Well done, Mr. Malhotra. We are proud of you.
Thanks,
I've also got a community hero awards as well from Hounslow Council. Yeah, which is nice. It's good achievement for this year, especially when we're going through really hard times. Very good. Well done.
I think the awards are more for the community groups which we are working with, and the three which they chose, I didn't have any choice over, but most of you know that I do a lot of work in different guises, but mostly as a troubleshooter to go and help charities. So I was ever so pleased to receive that. Thank you.
Yeah, I mean, we did identify some other resources which people could use to perhaps to communicate the message about BM communities getting the vaccine. So there's been a video produced by MPs. There's a link on Twitter to that. Another YouTube clip of high-profile figures encouraging vaccine uptake. So yeah, I think people are trying to combat the situation, but I suppose that's the idea, was just to prompt a general discussion about ways that what could be done to dispel the myths, I guess.
There's a number of reasons why Barmy communities may not have taken up the vaccines. One was, I was reading about this morning, was well, something that occurred to me, that care home residents, disproportionately fewer Barmy communities are in care homes, and of course they've been prioritized for vaccines, so that might skew some of the results. And I think there was an example in Liverpool where they started using community halls to reach people from the slightly more marginalized groups to ensure vaccine uptake. But I suspect that in West London we're not too bad on that, actually, because I know we're using the Dominion Centre and various halls.
Well, I think the biggest place is the Swaminarayan Temple up in Neasden. That has been a real godsend, and also the fact that some of the gurudwaras and also the mosque are now becoming venues. So
vaccine centres,
yeah. So because of that, the imams, the Gyanis, and the pundits, they are sharing that message, and as their leaders of their faith groups. And we had this very interesting talk as part of our Hounslow Friends of Faith event about this, and the very fact that Kelly and as well as others have picked up on the fact that using large faith centres, because they've got huge halls, so the social distancing is easy to do. People will come because they recognise the place, and transport access is easy as well.
And if you're not familiar with it, you will be more likely to be familiar with that than a medical centre or a hospital or a car park somewhere. Yeah.
So do you think sort of they could be using other methods of communication, so things like radio, podcasts?
Well, on our local community radio stations or the national radio stations, there are adverts coming already for especially people from the South Asian community. And on the TV, on those same TV channels, they're also using Her Majesty's government's videos, and they're showing a whole variety of people. And it is tending to be more focalized. And I'm sorry if I marginalize anybody, but there have been a lot of people who, because of their faith and the issues around beef and pork, it's created a real problem, especially within the Islamic and the Jewish communities, and also some of the Hindu communities. But there tends to be that kind of issue. And that's one of the reasons why I did what I did, because in my family, where we've got Hindu, Sikh, I have Ukraine Orthodox Church, my aunt's Roman Catholic. So I just wanted to make sure that we had a very good cross section, and I share actively the need for immunization. And we're very lucky in this country. I talk to my family in other parts of the world, and they're so jealous of the fact that we're doing what we're doing. Even family and friends who live in continental Europe, they just see the news and they say, why them and not us? And in the US, they were charging about $250 for a vaccination, and you had to really know someone to be able to get it. So with Biden, he's saying that everyone will get it for free. That's a complete change. But it's really important, the strong message that what I've given, and I'm sure others will share with me, is that it's vital that we get this immunization. I've been an advocate of polio since when it first became a national thing, and the biggest problem we faced were in places where we didn't get the support from the faith leaders. As soon as we got support from the faith leaders, we were able to get the immunizations done, and people were protected. And there are just two countries left in the world, that's Pakistan and Afghanistan. And I think with COVID, those two countries may still be the last two countries. But just this week, the Chinese have delivered their version of the vaccination to Pakistan, and they're just about to start theirs. So anything is possible. So let's just hope for the best.
I think there's also a bit of a misunderstanding about side effects. So like both my parents have had them. My dad had no side effects. My mum had mild symptoms of flu, very mild, but that's just normal part of having a vaccine. That's not getting the illness itself. So I think there's a misunderstanding between getting very mild symptoms, which is normal, and actually getting the disease itself.
Yeah. Well, I just had a sore arm for a couple of days, but then when I get my annual flu jab, I get the same thing. So all I did was just take a couple of paracetamols and just carried on. So when I have my second jab, I'll do the next story, and I'll share what my experiences on the second jab are. But as I said, half my family have had Pfizer and half had AstraZeneca. So, I'm just pleased that as their frontline key workers, they received it.
Yeah, Barbara?
I have a question about, I don't want to say homeless, because that's obviously another group, but we deal with a lot of people who are overstayers, and they're reluctant to register with GPs, and the GPs are quite vital in registering people for the jab. And just been looking up, there's an organization called Doctors of the World who are making sure that people register with GPs. So that's another group that might be missing out on the jab, and might also be subject to fake news and stuff like that, that immigration officials are going to be there. I'm not saying this has happened, but I'm just thinking of the potential there.
Yeah, Barbara, I was just going to say, during this time, and Richard's just come off this thing, but many of the homeless have been put into motels and so on. To some extent, I think that there is that gap where we need the equivalent of a district nurse type person to go to these various hotels where these homeless people are, who don't really have anything, and to get them at least get their vaccination done to help them, because if they don't get it, we've got the same situation as in the rest of the world, that until the rest of the world receives it, we will still have that need to have social distancing and everything else. But Richard's back, so I was just saying to Richard, I just commented that there are many people who are homeless and they're living in motels and hotels still. Those people are going to be missed out in terms of immunization. It'd be really great to have like a district nurse type person go in and immunize all those individuals.
Yeah, I'm thinking more of the visa overstayers who are living in precarious conditions in parts of West London, who are not with a GP, because it's the GP that presents to public health who needs vaccination, or NHS vaccination, whoever does the vaccination. So there's a link there that not everybody has access to, which disproportionately will affect people from a minority background.
Yeah, Nyoko, you had a question?
Yeah, I don't have a question, but I want to say thank you to Barbara for bringing some points out to us today. I read the email that you sent out. I will be putting up some resources on our website. If at all you want to share that information, or use some of the videos that we'd be putting up onto the website, as COVID champions. Mukesh, if I may use your article too on the website.
Feel free to, absolutely 100%. Send it to as many people as you like, because I promised Kelly that I would do this, and I did. Okay.
Thank you. Also, if anyone's using the local radio and how they're using the local radio, if you could, send me some information, maybe I'd share it on the group, and the other organizations can also use that in how they're supporting the community or encouraging the community to go in for the vaccination.
Look up Doctors of the World. So I hope that you're putting that link onto the website. They have links to resources in various languages.
Yeah. So I'll be putting it up on our Ealing and Hounslow website, where you have resources, and you can always use those resources.
They're a very good charity.
Yeah, and Médecins Sans Frontières. I'm doing a project with our local, one of our community groups. We've adopted a refugee camp in Palestine. And we've just heard from our coordinator, who's a doctor there, that they've just received their first batch of COVID-19 vaccines, which have been donated by, of all people, the Russians. So they're going to get the Sputnik version. So there are community groups in West London with Palestinian links, because there's a big issue of getting vaccinations across this kind of thin border, but it's as a humanitarian need and a humanitarian aid, it's happening. Well, there are 60, according to what I read, there are 67 different versions of the COVID-19 immunizations, vaccines coming through. Russia and China have got their own, but it's different from, they're not giving it to perhaps the Western world. But I've noticed that places like Croatia and other locations in what would have been the old Soviet bloc, they've started accepting the Sputnik vaccine, because they can't get it. They can't get the Pfizer or the Oxford AstraZeneca. So do you blame them? They want to protect their communities.
Anybody else got any points to make?
Yeah, Ian, I was thinking why they haven't offered the vaccine to the community organizations leaders who are leading a lot of work.
I think the people who give the vaccines have to be medically trained. So I'm presuming that's why they're trying to do it through.
No. I didn't. You misunderstood my question. They should have given to the community leaders this vaccine.
Oh, I see what I mean.
As well. So because we are dealing with the people on regular basis, and we should be able to get the vaccine as earlier as possible.
I suspect this might be a data issue.
Or the charity workers hasn't been accountable yet.
I think, Charanjit, the big thing is that they're working within the guidelines of what the government has said in terms of categories. And there are 9 categories. They're trying to go through the first five sets. But I think one of the things which, when the vaccine first came out, I think most of us may have read the joke about, well, if the vaccine is out, can we get the whole of Boris Johnson's cabinet to get the vaccinations first to see how it is? But that was only one of those kind of things which came out much earlier. But I think the important thing is, you're right, because some of the food bank organizers, which I know, they've been writing to both Ruth and Seema to say, look, we provide support to the community every day. We're giving out food parcels and things like that. Okay, we wear our gloves, we wear our masks, we wear our face shields, but we're doing this voluntarily. Should we not be considered to at least get some sort of protection? And I concur with that.
I think basically they prioritized older people over key frontline workers. So they thought, well, we'll go for the over 80s and the over 75s and the over 70s before we actually.
I'm not 70, by the way, or any 80 or 90. I just came into the shielding and vulnerable group, so I think I was category 3. I think
we
I'm
never count you in 70s, so don't worry about it.
Yeah, but I'm just saying, it's because I was in the shielding and vulnerable group. That's why when I got the phone call saying, would I, be prepared? And then I didn't expect that on the first day to be given a phone call. But I think they must, if they got the Pfizer the vaccine, once it's been defrosted or whatever they do, if we don't use up that valuable asset and put it into people's arms, it gets wasted. So I think the standby thing is really impressive. And it brought me back to the days of when I worked for British Airways, that you're there at the airport waiting for an empty seat, and I had 20 minutes to run to the gate. So I had 20 minutes to get to the 92 Bath Road. So I was very pleased.
I just want to say something. Since we're looking at COVID champions, we're actually going to be, supporting, or we look forward to COVID champions who would, stand for their community or encourage the community to come ahead. Wouldn't it be worthwhile if, we have a list of people who are influential within their community and they get the vaccination? Since, like Mukesh mentioned, since he's a part of a category 3, he got the vaccination, but there are other COVID champions who could influence, maybe the communities which are scared because of whatever reason.
Completely agree, and I think that's there's been so many valid points raised, and I've just been listening, and it's felt almost like exactly the kind of meetings that we love to hold with the community champions. This is exactly the type of thing that happens where we can share ideas. So yeah, unfortunately, it's as simple as the rules are made by the NHS, so it's not within our hands. So there are a lot of things that when Mukesh just mentioned the staff that are relentlessly working frontline in the food banks and things, I'd love for them to be able to just be kind of jumped to the front of the queue and been given the vax by now. But I think it's not something that, these are all things that are constantly being relayed to those that are the decision makers. I think it's a case of the constant. Sorry. So for the information to be constantly relayed, and it is because we're seeing the emails, we're having the conversations, but at the moment it just comes down to the fact that it's not in anyone's hands but the NHS in terms of how they're handling who is next and who is prioritized. I think things are changing, and there is more of a drive to understand that community level engagement is essential to be considered when devising the priority groups. But again, I can't say anything, but what I've said, which is I'm being told as well, because I grow frustrated with kind of the feedback that I have or the insight that I have from having spoken to people. So yeah, and the other point that I wanted to quickly just mention something on, I think it was Barbara that might have talked about the homeless community and the need for, and then Mukesh again talking about the fact that they've been temporarily housed in motels in the borough. I think again, it's a great idea just to have someone doing the vaccine on an outreach basis, going to these hotels and having them feel comfortable without threat of authorities getting involved, and again us being mindful that they are part of the community and they are as much in need of the engagement and messaging as well as the opportunity to be vaccinated and regularly tested. But I think regularly tested is something that again is proving difficult for a lot of engagement with a lot of communities. There's some talk about, there's rumors being spread. So it's great that I saw Mukesh's clip in the picture. But I feel like it would be great as well if Mukesh was happy to have the test documented, because there's a lot of talk about that discomfort and pain that comes with the test. And granted, I've had the test, it's not the most comfortable, but it's a few seconds of a fiddle and it's done. It's not something that leaves you wounded for the rest of the day or anything like that. But yeah, I think I love the idea of the stories being able to help illustrate that people like us, that people like you, people like me, making it very much relatable and familiar. These things make such a big difference in people and the uptake of any service. Yeah, I mean, Mukesh again, he mentioned firsthand that he'd sent both images of, I think, his parents and himself, and wrote a story or a blog, and that was enough to change a lot of people's feelings or mind, because they could just think, well, if this guy that I have respect for and understand, or is similar to me in demographics maybe and age, has done it, then why on earth would I not? Sorry, I'm babbling a little bit, but yeah, sorry.
I just as Saranjit mentioned, to have vaccinators within the community. What I've realized is that the NHS has rolled out a massive training for vaccinators and for administrators on COVID-19. And this enrollment has been going for the last 4 months. So in terms of having a community member that is able to have the training, the specific training of vaccination, that will be up to us to maybe pass on the information to the rest of the residents that someone might be interested in doing something like that. On websites, there's Find a Job, and indeed, there's a lot of advertisement on terms of program the NHS has already established. So in one regard, it's up to the NHS really, because they are the dictators of the regulations in terms of the vaccinator specific role. But yeah, there is a possibility of us informing our community members that there is vacancies available on that. I just wanted to add that up. If anyone is interested on chasing up this role, Find a Job is probably the best website. findajob.com.uk is the best website to go forward with. Thank you.
Yeah, Sasha, you have you can do whatever. If you need my parents' pictures, they're 83 and 88. I'm more than happy to share that with you. But and I'm more than happy to do anything because I'm involved with Rotary and I'm also involved with lots of community groups. I'm more than happy for you to go and just look on my Facebook page or my LinkedIn page. I put lots of stuff up on there which many people read, and then I have a number of different WhatsApp groups which I share, and I always try and give a positive message, because when we've had conversations with Kelly, your Director of Health, and with Steve Curran, part of that message has been, please give a positive story, or not necessarily a positive spin, but at least a positive story that you as a member of the community have had it. It didn't hurt. You sat there for 10, 15 minutes. I wrote my story during that period. And I thanked the nurse and I mentioned her, and she said, I'm very happy that you mentioned my name as well. So it just feels that way it becomes much more communal and local, and people will recognize the name. And I think that's what Kelly was trying to get us to do when she had a meeting with us as faith members. And I think what Ian's done today and the rest of us is that we're recognizing that storyline. So feel free when you do send out these notes, Ian. I sent you the clipping with the photo and the words. You can use that and quote those words if it helps in any way to get more people from our BME community, and as well as from the other communities who may be not willing to go in and have their vaccinations.
Thank you, that's really helpful.
I think the Black community is an issue. I suspect Asian is, we can deal with that, but it's Black community that is very under 50%
we do, but
or something.
Yeah, we do. But the problem with, as I said earlier on, Barbara, the big issue in terms of fake news or the anti-vaxxers is this issue around animal products. You tend to find far more people within the Jewish, Islamic communities who are thinking twice about it, and the Hindu community tends to be having theirs, but that's on the faith group basis rather than by the fact that you're from South Asia. But if you look at some of the things around, well, we've got the South African variant and some of the other stuff that's coming through across the country, which I read with absolute interest. I look at the significance in the communities in those particular areas, because at one time when you were younger, or even now, you could actually see which communities were across London. So you could actually say, oh yeah, there was a large Greek population in this part of London, a large Bangladeshi population. There's a Jewish, that was a faith-based one. Then you have the Afro-Caribbean, you had people from India, from the Gujarat state living here, Punjabis living here, but that is now becoming much more dispersed, but we still have a significant number of people, and it's more faith-based issues rather than anything else, which is creating the
Black
problems.
Community is the one that has a very, very low take-up rate, and that's not necessarily a faith group. So that's something maybe we should all be sensitive to here.
Well, that's true, but there's a significant.
I only see Ilay's here.
Yeah, if Ilyas was here, he'd be able to help us with the Somali community. But don't forget, within the Afro-Caribbean community, there is a significant population which we forget are from the Islamic faith groups. And that's where we need to get people like Ilyas. And I know that the work that's taking place with the Al Mustafa Welfare Trust, they've got opened a food bank at the mosque, the big mosque on the Wellington Road, and the secretary of the mosque is also trying to put the message out that please come and have your vaccinations. So there's a lot of positive news, which I think I need to share with, based on the work I'm doing, which is really important, which isn't getting as much, because like some organizations, especially news-based organizations, they're not doing enough to do the good news. They're only doing the bad news, and the good news needs to be that there are, we need to show images of people from the various faith groups having them, as well as people from the Afro-Caribbean population having their vaccination. The images need to be there. So part of Her Majesty's government's images recently have been where they've been showing people from different medical groups saying, support your medical teams by making sure you have your COVID. I think there needs to be the next storyline, which is having faces of people who've had their COVID vaccinations, from whether you're Chinese, whether you're Afro-Caribbean. there needs to be that kind of.
But the issues for not taking up the vaccine are slightly different, which is the distrust. There's a trust angle here. So that's, I'm not saying we can solve this right now, but it requires a slightly different solution.
Yeah, but you
so
can
it's
get.
Not, it's, you can get to the Islamic community, yes, some of whom are black, but I'm talking about the
but if you were to go to like the Seventh Advent,
the non-society participants.
Yeah, if you went to the Seventh Adventist group or somewhere from a Nigerian kind of group, and we have those in Hounslow as well as in Ealing, it's getting those faith leaders from the Afro-Caribbean. I have to say,
I'm of no faith, so I would be missed off all this. So there are many people who are of no faith.
No, my father-in-law, he's an atheist, but he's had his vaccination. But I'm just saying that we have in Heston, we have in Hounslow, some of those individuals, and it would be great if London Borough of Hounslow was able to go down there and talk to them and actually get them to just do what Nicole and I've done. And they have a large congregation, and if we can get them in, then that's the same principle which I'm trying to advocate.
We had the descendants here last week, I think. So maybe we need to ask them how to reach out.
So yeah, I think we've had quite a good discussion. Obviously, with this particular network, we've got 6 months funding. So that was the reason why we were starting off with weekly meetings. But obviously, we'll see how it goes in terms of attendance, because obviously weekly meetings quite high level of participation. But any ideas for sort of upcoming topics that we think we should be covering?
Oh, there's Sarah.
I mean, we'll try and get engagement from people from the council, NHS, anybody who's interested.
Yes, I think we need. Yeah, I think that's a good idea.
I think if we could get someone from the CCG about some of the work they're doing in supporting some of the work Barbara and the others are doing, or even getting some individuals from the church-based groups, because we need to get those individuals in just to share their experiences to help, because it covers a full spectrum. But and I think the need for technology, using being able to use social media, a single tweet can make a huge difference, as we all know, because of the anti-vaxxers. So let's try and get some positive tweets out there.
You're good.
Yeah, so we'll look at who else we can get. I think we found traditionally the CCG is slightly harder to engage with than the council. There's a bit of a crossover, because I think there's some people who are both CCG employees and council employees, but we will look into that. But yeah, thanks for attending. I will send out slides after the session, and the regular slot is going to be Friday mornings, 10:30.
I think Francisco, are you still there? Because I think although it's Portuguese speaking, I think it includes Brazilians and including some African communities. So he might be worth. He might have a channel.
I am still here.
Yeah.
From the vaccine side that I really came across with, there is a certain level of education that needed to be put across in terms for the members of the Portuguese-speaking community. In some aspects, they very distance of giving their own personal opinion. We have to relate with these, because great part of them have contact with the families back home, and is a cross communication between two countries. That's what they are value right now, is what they say in Portugal, or what they say in Brazil, or what they say in countries from Africa, and how things are evolving there. So everyone is keep asking the same questions. What are the after symptoms? what did you experience? Whoever has been taking the vaccine, everyone keeps trying to cross-reference on the information they have. So in some aspects, the level of information that is being put out, on the first instance, when I start approaching this subject, everyone was very against it. But right now I can see a few heads turning. So in some way is going to take, we need more time to actually educate people in terms of what is the vaccine itself, what are the side effects. This is the only thing that I can comment right now.
And some good news stories, yeah.
Yeah.
We need lot of relaying of photos and stuff, yeah. Okay, sorry, Ian, I didn't mean to hijack you. Just trying to sum it up.
I'm saying even basic things like you cannot get the full disease from getting the vaccine. I think there's still a myth out there that that's somehow the case when medically that's not possible, but it's just something that's hard to dispel. So yeah, we'll send out the slides from today, and like I say, we'll send out the link to next week as well, and we'll try in the meantime, we'll try to get some more speakers to come along. So thanks for attending. And
if I may just put in here, we'll also be sending out a survey monkey, Ian. Ian would be sending out in case
just to get some feedback about the session, and obviously any ideas you've got future topics, include that in the survey monkey link I send out to you as well. So thanks very much, and hopefully see you next week.
Thank you.
Thank you, everyone. Bye.
Thank you, everyone.
Thank you,
Bye.
Ian, for arranging all this.
Thank you, Ian. Thanks, everyone. Bye.